you hear me?
Yeah,
We're
good evening.
supposed to I hope everyone can hear me.
I can hear you.
From Faith, I'm so sorry for the delay. The network is kind of bad, that's why.
Yeah, it's everywhere. The network is everywhere. It's fine, no problem.
Okay, thank you very much. Um, Everybody, welcome to another episode of the Pele by Choice live chat. Today we have an expert field, Pam Faith. Welcome to our midst. Thank you for honoring the invitation. Um, so the topic for today is a very exciting topic. It's a topic that we need to actually look into, but most people don't know that it's a serious issue, and that is the impact of sexual relationship on mental health of women and girls. So this topic is a topic that you think?
Okay, we want to say a big thank you to our partners, AWDF, Global Fund for Women, WFD, Women for Women Alliance, PKT International Nigeria, Cross River State Ministry of Health, UNFPA, Cross River State Ministry of Health Development Agency. Thank you all so much for your support. So we are going to move directly to our speaker bio, which is Madam Adeluka. Are
Faith,
you
are you
there?
with us?
Yeah, I'm with you. I can
Okay.
hear you.
Okay,
Yes.
thank you very much for honoring this invitation once again. So this topic, I want you to know that the person that is going to be handling it is an expert, 5 years working experience. It's not a child's play. So welcome Fam Faith into our midst, and thank you for wanting to share more light on sexual relationship and mental health, because most people in Nigeria, provided it's not malaria or it's not typhoid, there's no other sickness. People don't take mental health as a serious issue in Nigeria. So our speaker today, which is Farm Faith Abba, did I get the pronunciation right?
Yes, you did.
Okay. So Farm Faith Abba is a pharmacist with 5 years of working experience in clinical community, industrial, and administrative pharmacy practice. Wow, that's really a lot. So that means our speaker has a lot of experience in this field. She has served in different capacity with accompanying certificates and ambassadorial awards, notable of which is a certificate in leadership and management in health professional development from the University of Washington, USA, and the UNIJOS ambassador to India. She has been a mental health coach since 2020. You see, say no be small play we come do today. Oh. Since 2020 is not a it's not a small journey. She is committed to helping hundreds of young women, especially ladies, dealing with mental stress, emotional trauma, low self-esteem, lack of self-confidence, etc. She helps them to overcome these issues. She worked for a while as a mental health pharmacist for the Bliss World app and has proficiently written several content and spoken a couple of times in secondary schools, rehabs, churches, and virtual meetings. She's an aspiring author currently working on her first book. Wow. When you finish writing it, will you send it to me? Working on
Definitely.
a first book with top-tier insider information on the skin disease acne, which is a major factor in poor self-image and low self-esteem. That is not a lie. When people who are dealing with acne, they really have low self-esteem. They have low image. So thank you very much, Farm Faith, for joining us and throwing more light on sexual relationship in relation to mental health. So moving on to the question. The first question is, at what age can a girl start indulging in sexual relationship? Over to you, Pam.
All right, thank you very much, Age Network. Thank you so much for having me. It's an opportunity and a privilege to be here. I really appreciate it. All right, to your first question, I would say at the age when you are, I learned this from a mentor, okay, because first of all, ideally in the society, the standard of, good morals and, according to the Bible, okay, if you want to go into the aspect of religion, the Bible, and I think the Quran also, the ideal thing is to, abstain from sexual relationship, right, till you are married. But of course, how many people are practicing the abstinence or waiting till your wedding night and all of that? That is still encouraged. That is still something we'll keep, speaking and preaching. But I learned this from a mentor, and the way she put it, she said, "You want to know the age," and then she said, "At the age when you are old enough, rich enough, and strong enough to bear the burden, the cost, and the stress that comes with sexual relationship." So there's no, I'm not going to give an age. Yes, please.
Hello, ma.
Yes, I can hear
Hello,
you.
ma. Can you hear me?
Mhm.
Please kindly unmute your video, ma. Open your camera. Thank you, ma.
Yeah, that's fine, no problem.
Yeah, wow. Very nice. Yeah, very pretty. Thank you, ma.
Thank you. Okay. Can I go on?
Go ahead, ma. Go ahead.
All right. So, yeah, like I was saying, at the age where the lady is old enough, and rich enough and strong enough, to bear the burden, to handle the cost, and of course the stress that comes with sexual relationships. So there's no particular age. I'm not going to look at this age, because like I said, ideally in the society, and if we want to practice, our religious belief, Christian or Muslim, it is expected that as a girl, you're never supposed to be engaging in, sexual relationship and all of that. So I think that's what I would say. At the age where you think and you feel you are old enough, usually when she said this, a mentor of mine, she was like, that it leaves it open for you. So you decide by yourself, okay, at what age am I old enough? Am I matured? Am I rich enough? And am I strong enough to be able to handle, the burden, the cost, and all that comes with, sexual relationships. So that's it for me.
Some Faith, you said a girl shouldn't be having sex, right? So if I'm correct, that means it should start from adolescent age, right?
No, it shouldn't even happen at adolescence. That's why I started by saying, ideally, according to the societal standard, which we know, okay, abstinence to marriage. So if you're going to be married at, first of all, of course, nobody encourages adolescent marriage, but if a woman is going to get married at an adolescent age, she can do that. But personally, I wouldn't advise any adolescent to engage in sexual relationships at all.
All right. Okay, so when you're talking, you said she has to be old enough, rich enough. Why rich? And then what's the idea behind rich? Like, why does she have to be rich? Or will I say, in what way does she have to be rich before she can consider having sex?
Okay, like I said, at the age when you are old enough. So now, as a lady, as a girl, do you feel you are old enough to handle the burden of sexual relationships, the pressure, the pain, and then rich enough because in the sense that it can bring when we talk further, when you're experiencing when you have pregnancy, when you get pregnant, you'll be able to support yourself. And if you want to keep the baby, being a single mom, you have to think about so many factors that come to play. Okay, in engaging in sexual relationship, or if you have like a health issue. Okay, I had a friend one time. She got into sexual relationship, and then contracted a very serious disease, and maintaining yourself on drugs, medications, and all of that for treatment and therapy to stay alive. It's not small money. Okay, so like I said, this was something my mentor told me. She was like, she's not going to give me an age, like a particular, okay, when you are 20, you can start having sex. When you are 25, no, of course, adulthood in Nigeria is 18 and above, right? So you can say an adult, once you're an adult. So, but once you're an adult, once you attain the adult age, do you still feel you can handle this sexual relationship, all that comes with it? So you have to be the one to decide for yourself if you want to stick to the what we grew up learning about, keep yourself in marriage, and or if you want to stick to that norm, or you want to handle yourself in what is happening right now. I don't know if you get my point.
Yeah, thank you very much, Faith. I really I really liked how you put it. But you didn't give a specific age, and I like that. And you went on to mention that a girl has to be old enough, rich enough, and strong enough. That means it takes a lot to actually consider that, yes, I'm old enough or I'm ready to actually have sex. You have to think about a lot of things before you start indulging in sexual activities. Thank you very much for that. The next question, Dorcas, are you there?
Yes, ma'am. Yeah.
Okay. So the next question.
Okay. How does sexual relationship affect the mental well-being of women and adolescents? Yes.
Okay, thank you. Sexual relationship affects the mental health and the mental well-being of women and girls because it brings about emotional attachment. That's the word, emotional attachment. So once you engage in a sexual relationship, there is an emotional attachment. It's like a bond, an intimate, a connection that is formed, okay, between you and that partner. So
Yeah.
once that connection, that intimacy, it usually has to detach. And the thing is this, most of the painful heartbreaks are usually the ones with which you had the person, the woman or the girl had a sexual relationship partner with the man. So it affects your mental well-being because once that emotional attachment is from, once that bond is from, it's usually difficult to detach. Now the thing is, for sex, for a man, sex is very physical, it's more physical than emotional. While for a woman, it's more emotional than physical. So a man can do what he wants to do and get it over with. And for a woman, it's emotional. It's like a tie, it's like a knot that is being formed. So it's like you're tied that man, and it takes a while. It takes a whole lot to break out and detach if the relationship eventually doesn't work out. So it does affect your mental well-being because once the attachment is formed, especially if you have multiple partners, you just feel attached to so many of them, and of course, by the time they start misbehaving, they break your heart. If you start experiencing heartbreak or you're experiencing trust issues with the man, it can really mess up with your mental. It can affect the state of your mind because you've lost trust, you feel betrayed, you feel cheated on, you can't concentrate on work, you lose your focus, you lose your attention to business, you feel used and dumped, like they say, and then at the end of the day, it makes you feel, you have this sense of, you just feel low, you feel used and useless. Sorry to put that word. You just, okay, this guy just scammed me and he has gotten what he wanted. So it affects your mental well-being terribly. Okay, so that's how it affects your well-being as a woman or as a girl.
Okay. Thank you very much, Faith. I want to ask you a question on still this mental well-being. Can you just give us a short description of mental health well-being? Like how damaging can it be when like we have issues that with our mental state, like in our mental state?
Okay.
Or should I
so when we talk about, pardon?
I said, should I come again, or you understand what my question? I said, do you understand my question, or I should repeat myself?
Please, you can repeat yourself.
Okay, I mean, like, can you just tell us briefly what mental health is? Like mental health in relation to sex. Just tell us briefly what is mental health. Right.
Okay. Mental health is just like health is the state of wellness. Okay, the state of you're fine, is the absence of sickness and the state of being fine. I'm trying to see how I can put it in a very layman's term. Being fine in your mind. Now, mental health encompasses your mind, and your emotions. You know, when you talk about your physical health and talk about, okay, if you have a cut on your hand and then, or you're sick in your body, you're experiencing malaria, for example, the common malaria, you're physically down and everything. So the mental health now has to do with your mind. You can't really see. If you have a cut on your arm, you can see that this is a wound, this is an injury, and it's paining you. You can feel the hurt and pain. This thing is paining me, and I need this thing to get healed. I probably want to get a bandage, take paracetamol and something like that to relieve that pain. But now in the case of mental health, you can't see it. You don't know what exactly is causing the problem. So mental health is the state of our mind and our emotions. Now, our mind has to do with, you know, the thought, your thought pattern, your imagination, your feelings. So is that soulish, you know, we have spirit, soul, and body, is that soulish part of a person, okay, whereby you can experience different, you can be healthy mentally and you can be sick mentally, okay? So there are some very common sicknesses that affect the mental health, very common, like very specific. If you talk about things like schizophrenia, things like mania, you know, manic bipolar disorder and all those conditions. And then you can have the ones that are not even trivial, but you know, you can't diagnose it like maybe schizophrenia, something like low self-esteem is a mental health issue, okay? Because you can't see it, it's hurting you, it's paining you, okay, but you can't explain it. It's being feeling you know, what's the word now? Anxiety is a mental health issue. Okay, inferiority complex, experiencing, okay, comparison when you're feeling I don't level up to this person, I don't have these privileges. You know that something is paining you, something is annoying, something is eating you up, but you can't see. So all of those things describes mental health. So when you are not mentally healthy, you have a lot on your inside, you have a lot on your mind. Okay, a lot weighing you down, a lot that you're thinking about that you can't really put your hands on it to like, okay, how do I get this up? How do I get my head clear? How do I get my heart to, you know, to be at peace? I don't know if you understand.
Yes, I understand you. Thank you very much, Ma, for that wonderful explanation. Moving on to the next question.
Yes,
Okay,
please.
our next question. What are some common mental health issues that may arise from negative sexual experience?
Okay, when you say negative sexual experience, I'd like to believe we're talking about something like rape,
Okay.
abuse, or even if it's a consensual sex, maybe it was a painful, it was like consented, it was painful, it was violent or aggressive. So I believe all that describes negative sexual experiences. Okay, so some of the common mental health issues that may arise. Number one, you can have PTSD. PTSD means post-traumatic stress disorder. Okay, this is a mental health issue whereby if you find yourself experiencing something or witnessing something that you have experienced before, okay, it can bring flashbacks. Okay, you can just start having a replay in your mind that because this thing has happened to you before. I don't know if you've heard about PTSD, okay, and then you're getting anxious. There's this severe anxiety and you're worried and you're scared and you know you start reacting because of the trauma you had experienced before. Okay, so that's a common mental health issue that can arise from a negative sexual experience, PTSD. Okay, another one is depression. Yes, depression can also arise from a negative sexual experience. Okay, for example, now imagine a girl or a woman who was probably raped, and then okay, the shame or not even shame, okay, the stigma or the pain of knowing that okay, maybe the person was a virgin, if you lost your virginity due to rape and all of that, and then you're sad, then this withdrawal. Okay, usually it starts from depression doesn't happen like that. Usually it starts from there's this sadness, overwhelming sadness, then you start to withdraw from your social life, from your social activities until you are depressed. And then you just can't relate with people and all of that. Okay. Worst case scenario, most people who experience negative sexual experience can become hyperactive or hypersexual. Okay, like I said, even if it's not rape or abuse, it can be something you consented to. It can be consensual, but it was negative. It wasn't something that was enjoyable or pleasurable. And then as a result of that, you can probably become hyperactive or hypersexual, and you're just looking for how to have sex up and down. And yeah, it can bring another mental health issue for you. Okay, you develop this hyperactivity, and it can there's this condition. I'm trying to remember the term now where you're having high what like the libido or something, and then you're just looking how to you become a
Sorry,
sex
I'm
addict.
trying to cut you in. Sorry, please, can you be a little bit slower? Like you're going too fast. Okay.
Okay, that's fine, no
Thank you
problem.
very much. Okay.
No problem. So yeah, I was talking about depression. Okay, it's another mental health issue that may arise. Okay, from negative sexual experience. So if you experience a negative sexual relation or intercourse, it can actually affect your state of mind. It can actually affect how you see men. Okay, it can also bring things like insecurity. Okay, it can bring things like trust issues. You just want to be on your own, in a world of your own, and stuff like that. So they are all intertwined, they are all interlinked, and it can actually affect the woman's mental health.
Okay. Thank you very much, Pampit, for that wonderful explanation. I want to ask a question. What about obsession? Can it lead to obsession? Because as far as I'm concerned, I feel obsession is actually a mental issue too, right?
Yes, definitely. Whereby the woman wants men more, right, or wants sex more, right?
Yes, like wants to even be with that person, like just doesn't want any other person to be around that person. It's possible,
Yes,
right?
even though it was negative. So you can see how counterintuitive that is. It was a negative sexual experience, but she's feeling upset and she still
Yeah.
wants to. Just like when a woman is being beaten by her boyfriend, but then she doesn't want to leave, she still wants to stay. It's a mental disorder on its own.
Wow. Wow. Thank you
Thank
very
you
much.
very much.
Wonderful explanation. I really didn't know that. But I want to ask you before we move on
Hello,
to next.
hello,
Sorry.
Madam Derunke.
Ma?
Please, can you kindly open your camera? Thank you.
I don't know if you can see my face, but let me know if you can see it.
Yes, we can see.
Okay. Then from Faith, you mentioned PTSD, that's post-traumatic stress disorder, and then depression. I thought they were intertwined.
Yeah, yes, they are. So most times, once a person can be experiencing PTSD, and it can eventually lead to depression, but it doesn't always lead to depression. So it can just be a PTSD, or just expressing that post-traumatic stress disorder, okay, because of what you had experienced before.
Okay, thank you very much. I didn't know that negative sexual experience relates to that lots of mental health issues. Thank you for throwing more light on it. So the next question.
Okay.
And next question. In what way can positive sexual relationship contribute to better mental health for women and girls?
Okay. So when we say positive sexual relationship, I'd like to believe you mean the sexual relationship that was, pleasurable, it was enjoyed, it was satisfying, I believe.
Hmm.
It wasn't great, it wasn't abused, okay, it was positive, it was a good one. Okay, it can actually contribute to a better mental health for women and girls, or rather women. Let's leave girls out of it right now, because personally I feel girls, if we're talking about girls, we're talking about preteens or teenagers, they should not be engaging in a sexual relationship. I believe strongly that young ladies in primary school, secondary school, their mantra should be book before boys. Book before boys. So they should not be engaging. It's important. If you have young ladies around you, encourage and advise them to abstain. So let's just stick to women. Okay, so it can actually contribute to better mental health because first of all, sex is not bad. It has its medical benefits. There are a lot of medical biological benefits of a good sexual experience. Okay, it can boost your immune system. Sex boosts your immune system. Sex can help with release of certain hormones. Okay, that help in your mood. It can help in relieving stress. Sex release stress. It can improve quality of sleep. It can reduce anxiety, both for men and women now.
Stress. How do you reduce this stress?
It does reduce stress. Yes, sex reduces stress.
Reduces stress
That
and reduces stress.
okay, now that's the thing now. You're
It's ener-
doing if you find yourself doing the right thing at the
okay.
wrong time, it's most likely the wrong person. Something that's supposed to relieve stress and make you feel good, we bring stress.
All right, all right.
So, we have to go back to sticking to the ideal of not engaging in something we shouldn't engage until the right time. Because once you find yourself doing it out of maybe fear, you have to hide. Like I remember, sometime in my secondary school, some students were caught. They're trying to have, or rather, they were having sexual intercourse behind the school garden and stuff. And then in the process of trying to be fast, everything wants to do everything, and then they got caught, they got disgraced, embarrassed. So something that's supposed to bring you, that's supposed to be good, that's supposed to help you, you're supposed to enjoy it and feel good about yourself. If you do the right thing at the wrong time, with the consequences. So instead of relieving stress, you have stress. So a positive sexual relationship can actually contribute to a woman's health and a woman's mental health. Now, speaking of mental health, it can boost your self-esteem. Okay, I had a client once that we interacted with, and once you have a positive sexual relationship, okay, and your partner, you feel when you feel desired, when you feel appreciated, when you feel attracted to this man, to your partner, okay, it boosts your self-esteem. You have a positive self-image. You have like a heightened self-esteem, self-love. You appreciate your body more. Women have this insecurity of body. Okay, am I fine? Am I in love? Most women do? Am my boobs a big enough? All those things that you are wondering, that consciousness of your body and everything. So a positive sexual relationship can contribute to better mental health for you because it will boost your self-esteem, it will boost your self-image, it will help you medically, like I said, the biological benefits. And I'm still going to repeat this. Positive sexual relationship will not happen if you're doing the right thing at the wrong time with the wrong person. Yes, so I think that's it for me.
Thank you very much. Wow.
Thank you very much.
I don't learn a lot today.
Honestly.
Sexual relationship and mental health. Thank you very much, Faith. Moving to the next question. Okay.
All right, our next question. What role does communication play in maintaining healthy mental well-being in sexual relationship? What role does communication play in maintaining healthy mental well-being in sexual relationship?
Okay, thank you very much. Communication plays a role of bringing understanding. Okay, it plays a role of bringing clarity, and which can increase, connection and first of all comprehension and connection between partners. Okay, so it's important for partners to communicate. Okay, communicate. Talk about your past. Okay, talk about your experiences. Talk about your fantasies. Okay, these are some things that partners don't talk about, married couples don't talk about, and it can actually affect your mental well-being. Okay, that should be in 2022. Okay, I was with a friend of mine, a medical doctor, so he was in the counter. I wasn't supposed to be there, we're just gifting, so I don't count up I was supposed to be in the doctor's counter room, so I just got to hear, and then this man was complaining of vaginal tear. Each time her husband makes out with her, each time they have sex, he doesn't even practice the whole foreplay. So he just goes in and then he causes her vaginal tear, severe vaginal tear. And then she's bleeding and she's hot, she doesn't enjoy the sex. So they don't communicate. That's the problem. If you communicate, you tell your husband, okay, this is what I want, this is what I don't want, or this is how I like being taught. I don't get to talk about orgasm. Okay, it's important that partners communicate. Because if you don't communicate, if partners don't communicate, that's the role of communication is to bring that clarity, to bring that understanding, to foster the intimacy and connection the partners have. Okay, and it will help maintain a healthy mental well-being, because if you don't communicate and your partner doesn't satisfy you, you probably just go throughout the day angry, tired, you will not be productive at work because all you'll be thinking about is sex, the sex that you need. You just need someone to satisfy you. Okay, as a woman, you didn't get to orgasm, you just want sex, and then you can be very vulnerable. Yes, it can make you very vulnerable, and being at a vulnerable state is not the best place you want to be, mentally, especially when you're around people that would want to take advantage of you. Okay, so if you don't communicate, you won't have understanding of the peculiarities of your partner's body and what they've experienced, what they fantasize. So I feel like communication, or rather, the role of communication is to, bring that clarity, that understanding that will foster a strong connection between partners. And yeah.
That's very true. Thank you very much. The next question, please.
All right, our next question. How can societal attitude toward women's sexuality impact their mental health in relationship? That is, some women that is so like the way they are behaving, like they are doing emotional, then how can it affect their mental health relationship?
Okay. Societal attitudes. Societal attitudes differ. Okay, in the society, you can have people who, you can have a percentage of people who still stand for, okay, as a girl, as a lady, as a woman, keep yourself to marriage. That's one
Yeah.
percentage. When you are married, you can have the other percentage of people in the society that give you the attitude of go and have sex, explore, have sexual experiences to find compatibility. Look for who is sexually compatible with you. Give a man what he wants. Satisfy your boyfriend. Worst case scenario, even if it's not your boyfriend, they just want you to, that attitude. So I feel like societal attitude towards women, it can actually impact your mental health relationship because of the pressure it brings. Okay, there's a pressure that comes with trying to conform. You want to do it, everybody is doing it, everybody's saying everybody is doing it, and then you're under pressure to conform, you're under pressure to do what probably you didn't want to do before, but now you're under that pressure. So I feel like the first thing is, personally, you have to define your own values. Okay, you have to define what you want for yourself, how you want to go about having relationships and sexual relationships. Okay, because truth is, if you allow society to decide for you, you'll be swayed here and there. Okay, so I think the first thing is for you to understand your values, your core values, and your practices, such that societal attitude will not have effect on you that much. Okay, so that's why people are saying, okay, I knew of someone who was saying she was in a class one time, and then the teacher, a lecturer, was telling her that if you don't know sex styles or sex position, your man, you will not have a successful marriage. So you're under that pressure to go and learn all the sex styles, how to do doggy, how to do this and that, because you are thinking of a man to please and to perform so that he doesn't leave you. So if you conform to societal attitude and pressure, it can affect your mental health because you're no longer thinking for yourself. You're no longer behaving because of what you want. You're now being a people pleaser or a public pleaser, something like that. Okay, you're just going in the direction of what society wants. So I think the first thing is for you to decide what you want for yourself. Okay, am I going to stay and wait, or am I going to, you decide what you want for yourself and make good decisions that will not bring terrible repercussions. Okay, so you decide what you want for yourself, and whatever is happening in the society, of course, there will always be that societal pressure, societal attitude, and people always talk. Okay, so once you decide what you want for yourself, that's the first step to even protecting your mental health in the first place. Knowing what you want for yourself and not letting what other people think or attitude people give you in the society to, affect your decisions. That's it.
Thank you very much. What you said really even brought back some memories, because this attitude is actually killing some women in their homes. Someone will say, like when I was getting married, one of my auntie called me, say, as you're going to your husband's house, so make sure you please your husband. Don't deny him sex. But what if, like, I'm tired? What if I'm not ready? What if maybe I'm even having pains? Sure, you understand? Some women, because of what they feel like you shouldn't deny your husband sex whenever, however he wants it. They just keep mute, even if they are going through as in something at that moment of time, and it actually affects their mental health one way or the other. So thank you very much for that enlightenment. People are a lot and people are really as they feel pressured about this thing called sexual relationship. They want to do what everybody is doing. They are scared that if they don't do it this way, there will be consequences. But it's not really like that. And it goes back to the former question. It boils down to communication. When there is
Exactly.
communication, there won't be a problem when maybe your partner wants sex and you're not ready due to one or two things. When you guys communicate, he will be able to understand, and then that will actually be about no issue and all of that. So thank you very much, Dr. Faye. I think this is our last question for today before I now bombard you with my own questions. Okay, the last question, please.
Okay. How can mental health professional and support system address the challenge faced by women and girls in sexual relationship? Like today, we have our expert today in the field, which has been educating us. Thank you so much, Pam.
I think, or I would say, mental health professionals and support system can address the challenges faced by women and girls in sexual relationship by starting with awareness creation. Okay, that's usually the first step, how a mental health professional can help or address this challenge or a support system. There has to be some form of awareness creation, okay, awareness campaign, going for outreaches, hosting seminars, having virtual talk or conferences.
Okay,
Pardon?
now personalities, how do you address challenges faced by women and girls in sexual relationships? You, as a fam, as a mental health mentor, how do you address these challenges faced by women and girls? Over to you. Did you hear me?
Yes, I got you. I heard you. All right. So, like I said, the first step is creating awareness because most people are not aware. Now, when we say the challenges faced by women, right? Some of these challenges could be the challenge of we talked about abuse, rape, the challenge of even if it's consensual sex, there could be a challenge with contraception, contraceptives, use of contraceptives. We can have challenge of unwanted pregnancy or abortion or
Let's say
abandonment.
some of them, their family members that are living with them are even abusing them. Like, maybe they are abused and all of that. Those kind of things have come with stigma. So they won't really be able to talk about it. So like those are the challenges that we are actually kind of talking about here. Okay.
Yeah, so such challenges. Now, the first thing, if as a mental health professional, what I would do is create awareness. Okay, you can, like I said, I've been to secondary school, and then you wouldn't know because this is not something people want to talk about. So you can pass by someone who just came out from a room where she was abused, and then you can't see it written on her face unless you're really very close, and then you probably psychologically discern that. Okay, so what I would do to address this challenges. The first thing is to create awareness. Okay, so you find a target area. Of course, you can't start with the whole wide world. You have to start from where you are until you expand. You find a target area. You could go to a church, a secondary school, wherever it is. Okay, and then create that awareness. Make ladies to understand all that comes with the sexual challenges. Okay, if you're being abused, how you can speak up, where you can go to, how to hide, knowing that you will still hide the identity because nobody wants to, not something good to say or to come out with. Okay, so that's the first thing. You have to create that awareness. Okay, and then the second thing is to partner with other health professionals. Okay, like at the time where I worked before, we had an outreach, okay, to a rural community, young ladies in the community there, and then we took some doctors along, they did some tests. Okay, it was just for everybody just come. So there was session for testing. After the testing, you go for after the diagnosis with the doctor, you go for testing. You go for then if you're tested and then whatever they find, you get your drugs from the pharmacy, then there's counseling therapy, and then it was a faith-based organization. So there was after the counseling therapy, there was prayer section. Okay, because some of these things you might want to add the spiritual aspect to all of that. So I think that's one of the ways to address these challenges by creating that awareness. People have to be aware, okay, that these are stuff that are going on, and then they have to be partnership, okay, looking for like-minded people that will be able to reach out. Because the thing is, even when you've created an awareness and some persons have opened up to you, can you help them? So imagine someone who probably is having a particular STD, sexually transmitted disease, or sexually transmitted infection, and she doesn't even have the funds to afford her medication. She still has to sleep around to make money to be able to buy drugs. So once someone opens up to you, can you help them now? Such things like that, you have to look for how to partner with them that can help fund this, take care of their bills, especially students that are less privileged ladies or girls who probably, now not all families will support you if you get pregnant. I know someone presently, the father kicked her out of the house. So imagine if you don't have a supportive family like that will just accept, okay, you've made the mistake, we're going to take care of you, and this baby, they kick you out, and you have to start life as a single mother. You're on your own. So imagine a single mother who wants to open up and speak out, and then you can't help her. You just keep giving her motivational speaking and encouragement. So after creating the awareness, creating the campaign, creating a system or structure that helps them open up without being known or without being judged. There has to be another system to sustain them, most especially financially. Okay, so that's another thing, to partner with some organizations that will be willing to assist with that. And then this is another point though, but I don't really know how feasible that is. I know of a friend that started that movement addressing these challenges. It was to get the guy to accept responsibility. Okay, we had some cases whereby some men will get a woman pregnant and they'll run. You don't want to claim responsibility for the baby, you'll be like, you don't mean she slept with. So her movement was to find those guys, brutally get them, so you must pay, you must be there. So that could be another way, because it looks as though these men just do what they want and get away with it. They can deny you and deny your pregnancy, and all the issues come back to you as maybe shame that you open leg. Okay, so this awareness also has to be given to the guys too. Okay, to abstain or prevent and take responsibility for your actions. So I feel that's how mental health professionals and support system can address these challenges.
Okay, thank you very much, Faith. What you said is actually true, and it's really right. We need to create more awareness, because there are a lot of people. We might think because of social media, most people feel everybody's aware, but I can tell you that most people are actually not aware. You understand? Not everyone is on social media. Even some people that are on social media are not even looking at, they're not even looking at the creation, awareness creation, but they're just looking at entertainment. They're not looking at the education aspect of social media. So I want to ask you a question. How can we help? You said a woman has to be old, rich, and strong enough before she starts indulging in sexual activities. But a girl who is 15 years, who is already indulging in sexual activities and is kind of obsessed with sex, how can we help such a person? That's my question.
If you have a 15-year-old who is already indulging in sex and probably obsessed with that,
yes,
what that kind of person needs is professional, expert attention and therapy session. Okay, because she's already exposed to it. Her body's already sensitized. So the first thing is, does that person need help? Okay, because most persons who you want to help are not willing or are not ready to be helped. Okay, so if that person opens up to you about, I want to stop this, recently we had a group of guys that smoke, and then you could see some telling you, I really want to stop this thing, but I cannot stop, because that's addiction. I've met them plenty. They'll tell you, I want to stop this cigarette, but they're still smoking. They're still, taking the weed, and they know that it's damaging their lungs, but they don't know how to help it. So you need professional. That's such a lady needs professional attention, expert attention, and professional therapy. Okay, it goes beyond motivational speaking. It goes beyond, there has to be a structured guide on how to get her to withdraw. There's something we call withdrawal symptom from alcoholism. Okay, if someone is a chronic alcoholic drinker and the person wants to stop, you don't just stop it completely. It will cause problem. Withdrawal symptoms. So from 5 bottles, the person can start doing 3, the person can start doing 1, while you're still giving medication and treatment and counsel. So the same goes for sex addicts who are already obsessed. If you were probably having maybe 10 men in a day, your therapist or your counselor, the professional handling that person would watch you go, maybe do 5. You understand? You can't just say stop having sex completely. No, that addiction is already there. Do 5, do 4, do 3, and then in between that, break, that stoppage, there's counsel, there's therapy, there's guidance. okay, and that such a child, such a girl needs a complete reorientation. Her mindset has to be completely changed because the mindset something, okay. So such a person, I should probably need the love and support of family and friends. The thing is, once they started all those kind of things, the next thing is to feel maybe I don't do I'm already, make I just continue. I don't send anybody, papa. All those kind of actions, they don't want to stop. They just feel like they are too messed up or they are too into this thing to come out. Okay, so they have to be non-judgmental care, non-judgmental love, show of support and intentionality. And the person herself has to be willing, knowing that, okay, look, I need to stop this. This thing is affecting my health. This thing is going to cause me problems. I've probably had so many abortions or I've probably had too many sexual partners and I need to stop. So I think expert attention is what is needed for such a child. And then before that, at the home level, I believe parents should still be strong on instilling good morals, good values to their children. Okay, hear some of our older women, they did it to me too. If a man touch you like this, you're pregnant. Those things they told us, never let a man touch you like this. The counter was strong growing up, such that my dad doesn't want to even hear. At the time I was coming back from school and I was trying to cross the road. And then a man held my hand to help me cross the road. My dad cited me. He beat me that day. Because I wanted to allow him to hold my hand to cross the road. So I feel it still boils down to parents in the home, counseling your young girl, counseling your child, the mother and the father about giving them the sexual education should start from the home before the girl goes to school or goes to church. So that's it.
That's actually my next question, my last question for you. Actually, at what age should parents start sex education? Because whether we like it or not, that's actually where the problem is coming from. Lack of sex education amongst parents and their children. Even when we went out for sensitization recently, a girl who is about like 18 or so, when we wanted to tell her about unwanted pregnancy, our grandmother told us to go away. We should leave her alone. All that. Yeah, she told us to leave her alone. That what does she know? A girl who is more than 18 years, they're still saying what does she know? So at what age should parents start, sex education with their children?
Okay. If it was back in our days, I would say once a lady have, getting towards puberty age, right? That's I think 10, 11, so or before her menstruation. I think we have those who start menstruating as early as 9. So before that age, so that's why we was back in our days, okay, preteen and teenage age, okay, before puberty, before menstruation, like when I grew up and then when I started menses and all, that's where they said, and now you are seeing your parent, woman, small thing they touch you, pregnant. But now in our day to day, trust me when I tell you, as much as that child can read, can understand when you can listen when you say come and the person comes. So I'm talking about 3, 4 because we have pedophiles. Okay, we have pedophiles and people that are raped for 3 years, 4 years. So you should be able to tell your child, okay, that's where I stayed before, the school, and then the time rape was very paramount. And then I remember the woman telling her, I think the girl was like 4 years old, like, don't allow anybody to touch you here. She was pointing at the breast, don't let anybody touch you here, don't let anybody touch you here. Anybody that touch you there, shout. Do you understand? She's already sensitizing her daughter. Shout and then come back home and tell me because most kids can be raped at 4 years, 5, 6. So it's important to start telling your child in our day to day from a very once they can hear come go. Start telling them, of course, you not go all out with how you can. You have to use simple English. As simple as don't allow anybody to touch here, don't allow anybody to put their finger here, don't allow anybody. Because even nowadays, you know that cartoons for children are already having sexual content. Cartoons for children, I watched one recently. It was terrible, like with all the whole gay scenes and all. Even our books now. I think a friend of mine in the UK, the normal ABC that A for apple, B for ball, they have a different ABC book, A for what, B for bisexual, G for gay, L for lesbian, for ABC of 2 years. Exactly. So imagine children already getting exposed. If you don't start telling them, social media will. And most schools now, they want kids using gadgets, using phones, having access to AI, having access to computers at a very young age. And these ads, you keep seeing ads popping up on their computer. So if you don't, as a parent, as a father, mother, sister, whatever, you don't start telling those kids from that tender age, social media will teach them, their school will teach them, there was a time my pastor's wife was sharing with us that her daughter is just 6 years, came home one day and was telling her, "Mommy, why did Nick leave Santa Claus? And Santa Claus loved him so much." Currently, she had watched a cartoon about they had made Santa Claus now for that Christmas that we know had a gay partner. And the gay partner left with them. Santa Claus, Nick left Santa Claus. Santa Claus was the only one doing the delivery of gifts. So she came back and was like, so mom was like, there's no Nick. It's just, we all know it's Santa Claus. But the whole thing was crazy because she had to start telling her daughter from that young age. So in our day-to-day, the rampage is much. The visual content, the mainstream media is more. So I would advise from a very tender age, start telling them, okay, using simpler terms, of course, and as they grow, keep telling them about what they need to know, what they need to avoid, the health risks involved, the issues involved, and getting them very, very aware, teach them from the home. Like the Bible says, train up a child in the way he should go, and when he's old, he won't, depart from it. So that's my take.
Thank you very much, Faith. Thank you very much. This was really an engaging and exciting and interactive section with you. In fact, you opened the book, you dissected the book, you explained very well.
Honestly. Most importantly, the one Madam Derunke, the one I even just what she even led me to lead me back to this last sensitization we had with one of a woman that said, she said that we need to create awareness by walking around and going for sensitization. Last time that I went to, there was one environment that we went the market. One of the women said that the reason why some women refuse their husband sex is because their husband is unable to provide. But today she even made me to understand that communication, the way I actually told the woman the same thing, that is the way you are communicating with your husband in the house that will make your husband to provide what you need. The woman says the lie is not true. That is because her husband just feel like it doesn't care. The husband doesn't care about her. I said no, it's not true. And today our farm also make me to understand that this communication matters a lot. Farm, thank you so much. In fact, I love you. I learned a lot. Thank you, ma. All right, we have come to the conclusion of today's live chat. One more time, Pam, thank you so much for honoring our invitation, and we are looking forward having you on our next show. I hope that it will be possible. Thank you so much.
Thank you very much.
Exactly. All right, but thank you, ma. Are you a woman with unmet sexual and reproductive health needs? You can also contact us. Our WhatsApp is everywhere. We have a contact in Calabar, Lagos, anywhere. You can contact our health practitioners are here. They are here for you to tell you in every area of your life that you needed us. We are there for you. Bella by Choice is everywhere. We are even carrying out sensitization in everywhere for young women and girls to know their rights, to know their sexual rights. So even today, you just hear what our farm has already told us. Even me, I learned a lot today. Thank you so much. You can log into our YouTube channel, share it to your friends, share it to your loved one, share it to people you know, even include your enemies, because they need it. They need this information. Thank you so much. And also subscribe to our YouTube channel for more video and more live chat. Thank you very much. Bye for today. Looking forward to having you next week by this time. Bye.
Bye.
Bye. Bye.
Bye. Thank you so much. Adironke. Please, what's your name?
Thank you, ma. Thank you, ma. Bye, ma.
All right, bye.
Bye.